Welcome to Medent tutorials. Today is simply an introductory section, just introduction. All right. So at the end of the day, we should go through what we call Ghana Medical and Dental Council, what GMDC is all about. We'll go through it. We'll talk about the examination areas. We'll be discussing the examination structure. We will talk about preparing for the examination or how to prepare for the examination. Recommended materials that you will need in your preparation. We'll talk about how to register for the exam. Today, some of you called me that you have been verified that you can take the exam. So it is part of the registration process. The mistakes commonly made in preparing for the GMDC examination. And last but not the least, some key notes to take home with or that you should note. So at the end of this presentation, this is what I'm going to be talking about. Then in our next lesson, we'll know what to talk about. All right. Because in preparing for these exams, you have to understand what it is all about so that when you are preparing, you know which areas to focus in. You know what is priority. Very important. And this, many of you miss it. And then you'll be reading so many things that are, it's going to say non-fa. But today, we shall go through some of these things. So, GMDC, basically. So, it's a council. So, this is a medical and dental council. It is what we call a statutory body that is established by law. So, it's a law. This Ghana Medical and Dental Council is a law in Ghana. It's a law in, I'm not a lawyer, but that is what it is. What is their objective? Their objective is to secure in the public interest the highest standard in the training and practice of medicine and dentistry. Medicine and dentistry. All right. So that is their basic role or objective. What is their mandate? What are they supposed to do? Standards, training, registration, and regulation. This is their mandate. This is what they are supposed to do. What is their vision? So the vision of GMDC is to have what we call an internationally acclaimed, competent regulatory authority for medical and dental practice in Ghana for the public good. Then their shared vision and motto is guiding the profession, protecting the public. Guiding the profession and protecting the public. So now let's move to the meat. The examination, the areas you have to be looking out for. You know, in our various schools in Ukraine, in China, wherever we trained, Cuba, whatever we trained, we learned so many things. But for the purpose of the exams, there are some specific areas you have to focus on. These are internal medicine, surgery, obstetrics and gynecology, pediatrics, and community health. For some of us who were in Ukraine, you can attest to the fact that our community health is very, very poor. Because we don't understand anything, because it is their community health. So it is what they see, is what they treat or they do. In Ghana, it's a completely different thing. And in fact, community health is an area that they hold in high esteem. They don't joke with it. And we are going to go through all of these subjects or subject areas. All right. Now, you need to understand the exams you are coming to write, what it entails. And that brings me to the examination structure. Now, this exams is made up of multiple choice questions and an OSCE part. The OSCE simply refers to objective, structured, clinical examination. So we have two parts to these exams, MCQ and the OSCE or the OSCE. So let's move to what the MCQ is all about. The MCQ consists of 200 questions. 200 questions. Now, it is divided into other stuff. The first set of 100 questions, okay, consists of 80 basic science questions. I repeat, we have 200 questions, but the first 100 questions consist of 80 basic science questions that are grouped under 4 disciplines. Don't worry. I know I'm saying 100, but I'm saying 80. I'll come to that. All right. So we're having what? 80 basic science questions grouped under 4 disciplines, meaning that for each discipline, you have about 20 questions. What are these disciplines? We have obstetrics and gynecology, internal medicine, surgery, and pediatrics. Obs and gynae, internal med, surgery, and then we have pedics or pediatrics. Now, these basic science questions are not the usual straightforward basic science questions that you can think about. These are clinically applied questions, although it is a basic science. So it must have some clinical implication or significance when you are preparing for these exams. And that's exactly what we'll be doing with Medent tutorials. We have some high yield questions or topics that will be going through them one after the other. By the time you are done, trust me, you should be ready for this exam. All right. Now, the second set of 100 questions are also 80 clinical questions under each of the above mentioned disciplines, which are obs and gynae, internal med, surgery, and pediatrics. So these are what the clinical questions. Clinical questions. All right. Now, each section, whether you are talking about the basic science or the clinical questions, each is supplemented with 20 community health questions. So for the community health, there's nothing like basic science for community health. Okay. That is why I didn't add it to the 100 questions. But of course, you have 40 community health questions, 20 that might form under basic sciences and 20 that might form under the clinical questions. But again, for community health, it doesn't matter whether it is basic science or not, they will just ask you. So you have to be prepared for it. But for the other disciplines, it is specifically basic science, but with clinical application and then some clinical questions or the thing that we see in the world, basically, type of questions. So again, we'll go through all these set of questions. Excuse me. So you understand things better. All right. Again, write your questions down if you have any. And at the end of the presentation, I'll take my time to re-emphasize on them. Again, I said we have the MCQ and then the OSCE part. Now we've dealt with the MCQ. Now we are dealing with what? The OSCE. For the OSCE part, it is also divided into 2 parts. These are manned station and unmanned station. Manned station and unmanned station. So in OSCE, a manned station simply refers to a station where a standardized patient or an examiner is present to assess a candidate's clinical skills or knowledge. So what it means is that you have what? A standardized patient or somebody who is there behaving like a patient or An examiner is there to assess your clinical skills or knowledge. Whereas unmanned stations are stations where candidates just complete tasks or answer questions based on a provided materials without interacting with a live patient or examiner. So get to know the two difference. Manned station, unmanned station. Manned station, you will have a patient there. We call them standardized patients. Whilst with the unmanned, you don't have a patient, but you also made to answer some questions, and they're all going to test your knowledge about that thing. Good. Now, the unmanned, that is the station that you don't interact with a live patient or examiner. Candidate will answer 22 questions. So it's just like when we were in our, secondary schools, you have plenty of questions to answer, right? Question 1, question 2, question 3. But under each question, we have what? Sub questions. Yes, you have sub questions. You can say question 1, 1A, 1B, 1C, for instance. So with the unmanned station, candidate will answer 22 questions with sub questions, but the main is 22 questions. Now, questions will be mounted on a projector. Okay? It will be mounted on a projector, and you only have 3 minutes to think. Then you answer each question. You just have 3 minutes to think. So they will project something on your screen, normally a projector. Maybe what do you see? They can show you maybe a patient who is jaundice, for example, or a child who is jaundice, and ask you, what is that? And you're supposed to just answer. All right. Now, the 22 questions consist of 10 questions under community health. Community health is important in Ghana, guys. 10 questions under community health. Out of the 22, you have 10 coming from community health. And then 3 questions each under each of the other disciplines, making 12 questions, isn't it? Because now we have 4 disciplines. Out of the 4 disciplines, you're having 33 questions. That gives you 12 questions plus the 10 questions of community health, and that gives you a total of 22 questions. So, community health is important for GMDC. All right. Now, let's go to the manned station where you have a patient. There are 19 stations. When we say station, simply refers to a place you go and stand to be examined. That is just a station. Maybe there's a table there, you have to go there. On the table, you stand there and then answer a question. That is simply a station. And we are saying that in the manned station, there are 19 stations. 19 stations. So we have 4 stations, each under obs and gynae, surgery, child health or pediatric, and then medicine. So we have 4 stations under ops, surgery, pediatrics, and medicine. And then we have 1 station for community health. That's for the Viva. So normally they will be asking you questions, plenty things. All right. They can even ask you who is the regional minister for, or who is the health minister. Anyways, that is just on the community health. Then we have 2 rest stations, a place where you will rest. So basically, you have what, 19 stations. So 4 each under ops and gynae, surgery, child health, and medicine. 1 station under com health, and then 2 stations just to rest your brain. Now, the 4 stations consist of other things that you need to master. 1, clinical examination station. So that means during that station, it's all about clinical examination. And I'll move into details, a little bit details, under ops, surgery, com health, child health, and other stuff. All right. So basically, clinical station, clinical examination station, you need to master it. Then we have the procedure station. That means something that you have to actually do. Like, for example, part a catheter. It's a procedure, isn't it? Then you have your history station. Basically, how to crack a patient, how to take a very good history. And luckily for us, I have a whole tutorial on history taking. So we'll go through them. All right. How to take a history. Then we have data interpretation. Data, they can give you an ultrasound scan to interpret it. Yes. Give you an ECG strip to interpret it. So which means that you have to have a firm foundation in all of. In fact, they don't expect you to know plenty things, just the basic stuff. And by God's grace, we are going to go through them one after the other. And that's why I said you can't afford to miss Medent. All right, you can't. You can't. All right. Now, under internal medicine, we are still on the man station, so where you go through a lot of stuff. So we said for all of this, you have to go to what's called clinical examination. What are the areas to master? Don't go and master everything. There are specific areas you have to master. One, respiratory examination. How do you do respiratory examination? Very, very important for GMDC. Cardiovascular examination. So whilst you are in your homes, about to come to Ghana, some of you are not in Ghana yet. Some of you are in Ghana. Start practicing. Start practicing. Respiratory exam, cardiovascular examination, neurological examination. Practice it. GI, that's gastrointestinal examination. So these are the clinical areas or clinical examination they are expecting you to master. So don't go and be looking for so many things. No. These are the basic examinations to master. Then we have what? Data interpretation. Data interpretations. Complete blood count. You have to know the parameters over there. Liver function tests, their importance. The creatinine, the creatinine, the bilirubin, the SAT, the LLT, whatever. So liver function test. Urine dipstick. Renal function test. That's the creatinine and the stuff. The CSF, that is cerebrospinal fluid analysis. ECG, very important. The X-rays, the CT scans, the ultrasound scans, the MRIs. Then we have the arterial blood gases. You have to master these things. You have to be able to interpret when they say the partial pressure of oxygen is this, is that, is that. You need to have an idea of what they are talking about. All right. Then procedures. What are the procedures that you have to master? The procedures you need to master. IV cannulation. How to pass an IV line. They can give you a patient. Okay, do it. Catheterization. Some of you are afraid to put a catheter. When they give you a woman to pass, can you do it? When they give you a male to pass, can you do it? Then we have NG tube, nasogastric tube, how to pass it. The use of the glucometers for checking sugars. Do you know how to use it? Then let's come to child health or pediatrics. So you see, I've dealt with the things you have to focus on. So don't go and read plenty things. Just focus on what I've just given to you. Then pediatrics or child health. Again, clinical examination, almost the same as medicine. So you have to understand all those because the same thing, nothing different. However, they'll ask you to examine a newborn, examination of a newborn. How do you do that? Very important. So just note that. And for data interpretation, the same as medicine. They can give you ECG, they can give you scan, a lot of things to interpret. It's the same thing, nothing different. For the procedures, they love what we call neonatal resuscitation. Neonatal resuscitation. So if you master it, you are gone, you are good to go. They like you to check what we call the mid upper arm circumference, especially when the child is dehydrated or is not eating very well and stuff like that. They want to check for weight loss. Then hospital frontal circumference, also important to them. Good. So you see, now some of the clinical the procedures, you have to know what to call the pleural punctures for the procedures or thoracosynthesis. I didn't add it. Very, very important. So tonight they just called me before this the presentation. There's a patient there with pleural effusion. Guess what? I'm going to tap it. We are going to tap it. So we're going to pass a chest tube. How do you pass a chest tube? Which area? What are your demarcations? Anatomically, you have to know all of these things. And thankfully, we are going to go through them as time permits us. That's why I say you can't miss any of our presentations. Even if you miss, make sure you go online and watch it and ask questions. Under surgery, basically they are focusing on breast examination, superficial swelling examination. All right. They ask you to examine it. How do you talk about it? In fact, it's one thing to examine, another thing to pass the information. How do you present? How do you present? Don't worry, we'll go through all of those things. Hernia examination, anterior neck swelling examination, very important for the surgical team. Then ulcers. How do you describe your ulcers? Please, this is not referring to peptic ulcer. I'm referring to wound. You have to be able to describe it. Then for the procedures, same as medicine, the same thing. You can do the same thing. For data, not much difference, almost the same thing. So, but the most important part is the what I've listed: breast examination, the swelling examinations, hernia examinations, and ulcers. Then for ops and gynae, for clinical examination, how to examine a gravid uterus, meaning a pregnant woman. How do you examine? Fibroid examination. How do you describe that fibroid? Then for the procedures, you have to master what to call high vaginal swab, vagina examination, normal vaginal examination. You have to examine it. How do you describe it? How to insert or remove IUD, that's intrauterine device. I think it's for contraceptives, right? Then insertion or removal of, again, contraceptives. So you have to master all of these procedures, okay? And these ones, much of them can be done during the ward. And that is why if you're in Ghana, it will benefit you a lot. Or as you have been cleared to write the exams, do well to go to a teaching hospital. Again, don't worry. I'll mention all of these things in the presentation. So don't worry. So basically, we have dealt with the exam structure and what to look out for and what have you. All right. To this question, write it down. I will go through it with you again. Now, how do you prepare for the examination? One important thing, internship in Ghana. It's advised that you join the medical students and take part in all what they do academically, basically at a teaching hospital. That's what I was saying. Some of these procedures I'm talking to you about, it is not verbal. It is not verbal. It is not verbal. It is not verbal. And before I forget, don't forget blood transfusion too. It's also important because we do it a lot. All right. Some of these things skip me. So please just note that. But as we go to the presentation, we'll talk about a lot of stuff. So don't worry. And for those who will be closer to me at where I work, I got you covered. We will do a lot of procedures. So internship in Ghana, join the medical students or take part in all what they do academically. A teaching hospital is always advised. Because for teaching hospital, they'll be telling you the reasons why. Uh-huh. Although, if you go to a district hospital or a non-teaching hospital, you might be doing the procedures yourself. In a teaching hospital, you might not get opportunity to do the procedures yourself because there are a lot of MOs, a lot of house officers. So you there, you are last cry. But then for the teaching purposes, it's good to go there. And if you're a wild person, then you now move from there to another place where you can have a hands-on experience. Now, again, prepare for the examination. Always ask for advice from persons who have gone through and successfully passed the exam. Is that okay? So ask questions. So I'm glad some of you called to ask questions. And that's why I've given you this information. Now, the information I've given you, you might not get it anyway. Nobody might even tell you what it contains. But this is an advice I'm telling you because I've passed the exams, even though mine was different from this structure. But this is the current structure. So it's good to understand it and prepare accordingly. So take advice. Now, if your school doesn't permit its students to come home for internship, do well to have at least 6 months hospital attachment or classes before sitting for the examination to gain practical experience. Very, very, very important. I think I've already mentioned it. Internship or try and come and then do attachment. Very important. I think for people from China, they are given a year in their final year to come and do internship before they go back and write their final exam. But other places, it's not like that. Like Ukraine, you have to come home yourself and do your attachment or join the classes or something. All right. Now, personally, I never joined classes. I was in the hospital more. So I was just there, hospital, back. And I went for the exams. And everything was just hospital stuff. So it was easy for me to pass. But now the system is changing. So get classes to do, like what you are trying to register for now. Then form a study group with 2 to 5 serious students. I repeat, serious students. Don't go and pick somebody like me who is not serious. Boboka. So pick 2 to 5 serious students. The group shouldn't be more. Just few people who are dedicated, who are serious to study. Because the more you talk, the more you discuss, the better it gets into your head. Now register with the medical council. There is no way you can sit for the exams without registering. Now get a timetable or a timeline steady timetable with the aim of finishing at least 1 month to the examination. So assuming you are trying to prepare for the exams in June, just make sure before June you are done preparing. And if it's October, make sure before October you are done preparing. And if it's February, make sure before that you are done preparing and have ample time to revise. Very, very important. And Medent is here to help you, so don't worry. Practice the OSCE. Practice the OSCE. Very, very important. The more you do history taking, the more you do your clinical examination, the better you become at it. The better you become at it. And during the exams, you will not suffer in any way possible. You just enjoy it, basically. All right. Now, solve questions and have group discussions. Solve as many questions as you can. So, Medent, we're going to help you to solve some of these questions. But again, the whole work is on you. So, you have to study. You have to study. All right. Now, that brings me to recommended materials. Some of you are reading so many things. Please. There are recommended materials to focus on. One is the Davidson and Oxford Handbook of Medicine. So Davidson, very good internal medicine book. or Oxford Handbook. Very, very important. If you want them, let me know at the end of the presentation. Then those who are ready, I will send it to them to start going through it. Then we have what we call the Illustrated Textbook of Pediatrics. That's for pedics. Very good book. BAHA for surgery. Very, very, very good book. But it's very, very voluminous. Trust me. Very big book. Then we have Handbook of Obstetrics and Gynecology. In fact, your obs and gynae rest in this book. I tell you. So please get that book if you don't have. Then Public Health Medicine for the Tropics. That's for public health. So get that book and read it. Patoma. Patoma textbook or videos. Patoma. I think I have the videos. I don't know where they are, but I have the videos. Patoma. So if you have it, you are sorted. Of course. I thought you'd be laughing by now and you'd be smiling. Medent tutorials is one of the recommended materials you have to use. You see all this support I'm giving you thanks to Medent tutorial. So please, since you are here, make sure you are enjoying it to the fullest. All right. Then FMGE Solutions. I think it's an Indian book. It comes with a lot of questions. Trust me. The questions are sweet, beautiful questions. Trust me. So if you get that book, it will also help you a lot. There's another book for good examination question and answers in basic anatomy and physiology. In basic anatomy and physiology. Very, very beautiful book. And I think I'll be going through some of these things, these questions with you in the presentations. But again, you have to do the real reading by yourself. Okay? All right. How do you register for the exam? Today, like I said, some of you called me that they verified you because, so first of all, you have to verify. Your school needs to be verified that yes, it is a medical school and it is recognized. Basically, that's what the verification is all about. All right. So basically, go to the council for the registration form. So there's a form that is always given at least 6 months before your intended examination month. So if you are thinking of writing in October, then there's a time to go and get that registration form. If you're not clear about the requirement on the form, you can ask for clarification from the personnel at the office, or you can come and ask some of us, and we'll give you clarity. It is always advisable to submit your filed form, so your filled form and other required documents at least 3 to 4 months before your examination month, as the council will have to confirm your details with the institution you graduated from. Yeah, you have to confirm it. You will be informed by the council on when to make payment for the exam, which is mostly a month to the examination day. Yeah. So if you're thinking of writing in June, by May, you have to go and pay for it. Now, I didn't want to bring the amount here because it keeps different. Today is this, tomorrow is that. So when the time comes and you are ready, we'll find out the price for you. All right. My time it was about $700. I understand now it's getting to $900. Now, aside Accra, the council has branches in Kumasi, Takrady, and Tamale, where registration and payment can be done. So it's not all the time that you have to move to Accra to get it done. So if you're in these other 3 cities, Kumasi, Takrady, Tamale, you are sorted. Now, after payment, you will be given a date to come for a letter which will state your index number, venue of the examination, blah, 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 blah. All right. Now, that brings me to some mistakes commonly made in preparing for the GMDC examination. Some of the common mistakes. 1, not having at least 6 months hospital training or attachment in Ghana. No matter how good you are preparing, Some of you are preparing for PLAB, so you are really learning, which is good. But you must try and have this hospital training. If for nothing at all, 3 to 6 months, try and have it. Try and have it. It really helps because sometimes they fail you because they feel you didn't come to do clinicals. And they can know it by the way you speak. If you've seen something before, the way you speak is different from if you are just hearing it. You can describe, you can explain and explain and explain. But if it is just theory, after saying it, you are done. And they will know you didn't go through the system. And they will want you to go through the system, so they will fail you to go through the system. All right. Now, being in a rush to write because others have passed when you are not fully prepared. This is another mistake many of you are doing. Don't go and write your exam because my friend has done it and has passed. So me too, I must do it. When you know very well that you are not yet ready. Some of you have a lot of things on your head. Some of you are hustling, you know, looking for money everywhere. So you don't even sit down to learn. Some of you didn't get the right opportunity to meet groups to study. Some of you didn't get Medent tutorials to even study, right? Some of you didn't get the right materials, so you can see that you are not adequate. Please don't rush to take the exams because $900, if it is, it's not a small money. Multiply by 15, that's over 10,000. Please don't waste that money like that. All right. Now, starting to study too late for the exam. Some of you will wait maybe 3 months to the exams or 2 months to the exam. That's now the time you are studying. Don't forget, we said at least 6 months. Start preparing at least 6 months. So don't wait until it's too late to start preparing for the exam. So, for many of you, if it is your first time, I would advise you prepare for October or February next year. So you can have ample preparation for the exams. So you can know the in total of the exams. And when you get in there, the confidence level is different. Believe me. All right. Then using the wrong resource materials to study. Again, I've told you, if you don't have Medent tutorials, I don't know what you are learning. And before I forget some of the materials, we call it a TK Ankara. It's a clinical book. I forgot to add it. I just remembered. It's a TC or TK Ankara, one of them. Very, very good for clinical examination. So, again, I have the book. So, for those interested, let me know, and then we'll have something to discuss. So, using the wrong resource materials to study will definitely not make you pass. Then, study materials without guidance on key areas to focus on. You see, I've just given you some of the key areas to focus on. Don't go and be reading on far, please. Don't go and be reading on far. Very, very important. So, good. Now, depending solely on classes to pass the exam, that's why I said you are going to do a lot of work. You are going to do a lot of work. So please don't joke with it. All right. Then preparing alone. Some of you don't like to have groups. Preparing alone, you will miss plenty things. You have to have 2 or 3 or 5 people and form a solid group every day. Learn. Discuss questions, solve questions. Don't be doing it alone. Otherwise, when things change, you might not know. You might not know. Some of you got to come to this presentation because someone shared a link with you, isn't it? So imagine nobody knows that you're writing an exam, which I know. It's privacy. You don't want people to know that you're writing an exam. I get it. But if people are on this platform, try and interact with them because it means they're ready to write the exam. Then interact with them and then form a group and take it from there. Take it from there. Share ideas. Discuss questions. All right. then not heeding to advice from successful candidate of the examination. Like me now, by God's grace, successfully have passed. I'm advising you, you don't want to listen. Please listen to me. Like I said at the end of the presentation, I'll have one or two people to also advise you guys because they also pass the exam. And guess what? One of my products, let me put it that way. All right. Keynotes, some keynotes. Very important part of this whole presentation. One, without passing the MCQ, you will not be allowed to take the OSCE. Without passing the MCQ, OSCE, say it goodbye. You can never. So, for the purpose of this, Medent tutorial is going to focus a lot on passing the MCQ. Of course, if you don't pass the MCQ, how are you going to prepare for the OSCE? Isn't it? So, we'll do the MCQ mostly, and then we'll be chipping in some. Like I said, OSCE is more of if you are with a person or you come for clinicals, or so if you go to the hospitals, you will learn them. Trust me. And wherever you are in the country, let me know so that I can connect you to a doctor friend that will hold your hand and help you if you are doing your clinicals or attachment or intention, whatever you want to put it. But note, without passing the MCQ, you will not be allowed to take the OSCE. Now, the OSCE can be taken at any time after passing the MCQ. I repeat, you can take this OSCE anytime after passing the MCQ. However, after 2 years without sitting for the OSCE, you have to repeat all over again. I repeat, if you pass your MCQ, you have at least 2 years to prepare for the OSCE. If after 2 years you don't do the OSCE, you have to resit for the MCQ, pass it before you take the OSCE. So now there's no too much pressure on you, and there shouldn't be any excuse. And that is why you have to study smart. Study smart. And by smart, focus on the MCQ, then find time, again, study and pass the OSCE. Case closed. That's why I said, for you guys, I'm going to focus on the MCQ in passing the to make sure you pass the MCQ. Then when you pass the MCQ, which you will, then we focus on the OSCE section. I think that's fair. But again, I'll open the floor to hear from you what you think. Or we should do it everything together. Let me know. You decide. So we will see how it goes. All right. Now, okay. For those of you who are not following me, just follow me. I'm on Facebook at Medent, on Instagram at Medent_edu, on TikTok, it's Medent on tutorials. On YouTube, it's Medent tutorials. And of course, the website is medentweb.com. I will show you how it looks like and everything. But before that, I want to allow one or two people to say some few words